Ma'am, even after the couple, they undergo the treatments n number of times, they face many failures. So what is the reason behind it, and
Yes,
what is the solution for that?
Especially today. Today, there are a lot of patients coming to us with the 2 IVFs failed, 3 IVFs failed. So when I look at failed patients, see, one important thing that we need to look at is, was the IVF done correctly? One is, it should be done very, very perfectly. The IVF treatment requires a perfect stimulation. Everything should go. Yes, that is definitely there. So one thing is, was it done correctly? Was the timing for the procedure correctly done? Was the technique correct? So once I come across all these things and we tick mark, yes, this is right, this is right, then we try to sit down and discuss with them what went wrong. Was the embryo not right? Was the uterus not right? So then we go for the protocol of IVF that was used. There are different protocols. Even in the stimulation, when we give the hormonal injections, there is something like antagonist protocol. There is a long protocol. So we look at the protocol that was used. Was that creating a problem for the egg quality? So once we look at all these tests, we come to a conclusion. Then we see if we try to change the protocol and try to stimulate her in a better way. The other thing is, if she has had a day 3 embryo transfer in her previous cycle, so we would opt to go for a day 5, which is a blastocyst transfer, which has a higher success rate. So we go for we change the timing of the embryo transfer. We look at the other things. Was a uterine cavity normal? So there's a procedure called hysteroscopy, which I have mentioned before. So we check her uterus again to see if there is sometimes they may have a small septum. Septum means it's just a basic birth defect in the uterus. So these things which are projecting into the cavity may prevent implantation. So that septum will be cut. So these are simple procedures, but they improve the fertility potential for the female. And even with respect to fallopian tubes, some patients fail with history of tuberculosis. So in tuberculosis, they get tubes affected. These tubes sometimes get water collected in them. That is called hydrosalpinx. So sometimes when they are there, they prevent embryos from sticking to the uterus by dropping. These hydrosalpinx fluid may come into the uterus and prevent the implantation. So they are clipped through a laparoscopy. We clip their tubes away. That's called tubal detachment. So simple procedures we do to plan their next cycle. I already mentioned for you the embryo selection procedure, that is PGS. So that is used, the endometrial receptivity assay. So each patient with the couple, we sit, we discuss, we go through their previous file, previous records, we find out, and then we come to a conclusion and modify the best possible treatment to them. So the only problems that we see sometimes in women with very bad quality oocyte. So this is something that we can't do anything about, but we need to keep trying, because one thing a girl needs to understand is every month a new batch of eggs are coming. She always has a new chance. So next month these eggs are gone. So the IVF cycle may just be better the next month. The other thing is uterus lining. Sometimes it's very, very thin. We just don't get good lining. So at that time, we have no other option but to go for a surrogacy. Surrogacy is where it's basically we recruit another woman to carry her pregnancy. One of her relatives can just come across and we can put her embryos into them where they can carry the pregnancy and deliver the baby for her. So these are few procedures that is left for patients with repeated failures. Yeah.